Hello, good morning. So this is Zenab here at BII World. I'm going to briefly introduce myself. I'm the project director at BII, responsible for the program and the content development of our upcoming conference called Patient Experience and Engagement Summit. So today we are here to discuss about how the COVID-19 pandemic has redefined the face of the healthcare industry and what the future holds for us. So to begin with, I'm sure we'll all agree that uncertainty breeds innovation, and these are the most uncertain times in the healthcare. As we are all aware that COVID-19 has inflicted drastic changes to healthcare systems around the world and has kicked off a digital makeover of the industry. The research noted that the pandemic is set to reshape the healthcare industry with cutting-edge technologies in virtual care, such as Internet of Medical Things, teleradiology, telemedicine, remote patient monitoring, and virtual visits. The use of such digital health solutions are set to transform the healthcare system, providing ample opportunities to improve healthcare delivery and enhance the patient care experience. So with the intent to ascertain the role of technological innovation in response to the COVID-19 pandemic and discover how the learnings can be used to formulate strategic digitization plans for the future, today we are having a brief chat with a speaker from the upcoming event, Patient Experience and Engagement Summit. He's Dr. Ravi Sachdev from Tan Tock Seng Hospital. To give a brief introduction of him, Dr. Sachdev is a very well-known figure in the industry, and he's a consultant family physician and a deputy director of Transitional Care Services, as well as he's the lead for innovation at the Institute of Geriatrics and active region in Singapore. He's also the Tan Tock Seng Hospital's deputy Chief Medical Informatics Officer. So thank you, Dr. Sachdev, for joining us today. To begin our session with, I'd like to ask you to please kindly share your experiences of the biggest challenges that your organization has faced as a result of COVID-19 and how, according to you, the pandemic has redefined the patient and provider experience of healthcare.
Well, I think we're all facing uncertainty. Simple things like, do we go out, don't we? Should we wear a mask? Should we go to the hospital for follow-up appointments? I believe our patients' behaviors are changing, and we within the healthcare industry have to evaluate how care is being delivered or is going to be delivered in the future. It's not just about leveraging technology. I think it's about redefining the meaning of the patient-provider relationship. And that is something that's going to take a lot of work. It's going to require both clinicians and providers and payers and patients evaluating different ways of interacting and then determining what works for everyone.
I totally agree with that. And if I were to ask, what would you recommend to stop or to start and accelerate in the light of making the new normal work for the healthcare fraternity?
I think it's about information sharing, information being made available to our patients at the right time and place. So why would we consult clinicians when the internet is full of information on every conceivable topic? So the answer is because we need to make sense of the information, to personalize information to our needs as a patient, to investigate appropriately and to look into specific issues that we are facing, and then eventually to decide on treatment that is directed at the issues that we have. So all of these things start with the patient consult. And this exchange of information that was previously face-to-face and now has had to be relegated, some might say, to remote encounter, still needs to occur efficiently. And it needs to be a safe and secure environment where individuals can share information that is going to be important in deciding how to approach a particular care problem. So that is where we need to leverage on technology, not just to enable this exchange, but also to ensure that this exchange occurs optimally safely, as I mentioned, and securely in light of all the cybersecurity incidents that have happened. That is where I think the challenge is.
I totally agree with that. And this takes me to the another question that I like to ask and seek your inputs on. That 97% of the healthcare leaders have explained telehealth access since the start of the COVID-19 pandemic. As society begins to open up, what it will take for patients to feel safe returning physically to a clinical setting for healthcare services, and which services will remain virtual, and what do you think is the difference between telehealth, telemedicine, and a televisit?
There are currently a number of things that cannot be performed virtually, like surgical procedures or, let's say, dialysis. Patients need to be at a dedicated site for these things to happen. But what we can do is we should be trying to minimize the need for individuals to come to healthcare facilities for what I'd call non-touch encounters. Uh, this is not something that has been driven purely by COVID, though. Even before COVID, we recognized that it can be difficult for individuals to take time out of their busy schedules to attend clinic appointments, maybe sit for an hour or so in a waiting room, all the while being exposed to other patients who are coughing, for example. And there have been multiple attempts in the past to reduce these inconveniences using technology. But like everything else, things evolve slowly. It takes time to make these changes unless a significant push occurs, and COVID was the push. So now more people are aware that this is something that they want to basically participate in. They don't want to be exposed to unnecessary risks, and they are now open up to the possibility of alternatives. And this is how we are able to push through these initiatives. So to me, I don't differentiate between telehealth and telemedicine. I know some others do. To me, they basically mean the remote provision of healthcare services. A televisit, like a teleconsult, is a subset of telehealth, and it basically involves a virtual provider to patient encounter. And there are other telehealth modalities that coexist with teleconsults, for example, telemonitoring and even telecollaboration between multiple providers.
And actually, this is a question that really comes a lot often in the current time, because when we talk about patient experience, it's synonymous to human experience. And when it comes into the world of virtual care, how can clinicians convey empathy through their website manner?
Yeah, I like the term website manner. That's interesting. I think I'll use that more. But the fact of the matter is, it can be difficult to convey emotions remotely. We all know that video helps, but it may still seem distant and impersonal. So making eye contact, which might be quite simple in a face-to-face encounter, might be tricky on video. Should I look at the camera? Should I look at the screen? It isn't easy, but it's not impossible either. Empathy is not a posture. It's a deep appreciation of another's concerns and emotions. And that, I think, tends to emerge naturally from the language that one uses, as well as actions, of course. Yeah, I can't hold your hand remotely, but if I needed to, if I felt that it was important for me to reach out to you in order to convey a message or to be able to help you through a difficult process, I think that I would have to find a way to meet you face to face. As I mentioned earlier, not everything can be done remotely. Um, One can imagine that if I had to break bad news to someone, it would be very, very difficult to do so remotely. And I would try to find every way possible to be with that person, because I would then be able to help that individual deal with the fallout from that news.
Great.
Not easy, so but definitely can be done.
Yeah, I think there is a long fetch debate on that the digital transformation in the healthcare industry is not about replacing doctors, but it's supporting their profession or the caregiver's profession. And it's a debate which has two sides to it. And I'm sure where we should treat this as a supporter or as an enabler of driving and achieving patient experience outcomes and achieving our strategic goals of or the quadruple aim of the healthcare industry, basically. If I have to ask you another question, according to you, in the longer run, what if any changes, if any, should public health authorities should be making to enable institutions like yours to optimize patient experience during future health crisis?
Well, that's a loaded question. We've been through crises like this before, maybe not on such a large scale. Remember SARS, bird flu, swine flu?
MERS.
So it's becoming increasingly difficult to prevent these issues from arising simply because the world is shrinking. People are traveling freely. I think the single most important factor in curbing the current crisis thus far has been global lockdowns. And by that, I don't mean the enforced segregation, but rather the fact that people have to learn that these are not healthcare crises, these are byproducts of modern living. If each of us took responsibility for practicing good hygiene, keeping ourselves well, we would minimize the impact of any health issue on ourselves and those around us. So I think if there's one message that public health authorities need to keep driving, that is that people need to take responsibility. You know, the fact that there are people who continue to leave their homes when they're ill, or congregate in large crowds without masking up, for example. It makes me worried that the message hasn't yet gone through. And I think that we are now, over time, because this COVID thing doesn't seem to be going away very quickly, we are going to start to develop these practices, hopefully, into habit. And that in itself will help us through the next crisis if and when it happens. But then again, there's always going to be a group of people who don't buy into these things. And because of that, these issues will emerge again. So it is basically making everyone understand that it's our responsibility. If we want to be well and we want to keep the people around us safe, we have to perform certain basic tasks like, hand hygiene, looking after ourselves, keeping away from others when we're not well. I think that's what will make the difference more than anything else.
So that's like raising bar on community awareness and education amongst people to how to take care of their own health and to be educated and try and actually spread that awareness amongst the community as well. And if there was one, if there are lessons learned, or lessons that you've learned from your experience from the pandemic, what is the key takeaway message or a word of advice that you'd like to give away as something that people should imbibe in their daily lives for the community at large, as well as for the healthcare professionals or the caregivers?
I guess it's a message I said earlier that this is not going to go away very quickly. We have to get used to the fact that life is going to change, and not necessarily for the worse. So yes, we might have to have a little bit more social distancing. We might be reminded to check our temperatures or to, wash our hands or disinfect ourselves after every encounter. How is that a bad thing? I think we've been trying to get some of these ideas across for the longest time. We know that there are clear benefits to doing these things. And if anything, I think this COVID crisis has just simply increased awareness that these are things that help. I know it was enforced. Everybody was forced to stay at home. But the point being, look beyond the fact that it was forced into the fact that it actually worked. Now that people have come back out again, the number of cases has gone up, which tells us, we need to start thinking about how we ourselves have to be responsible to prevent this from getting worse.
And your thoughts about the technological revolution that's happening in healthcare at the moment?
Sure. So yeah.
Forward.
Yeah, I was going to go on to that. So basically, anyone who hears this message will ask, well, if I stay at home, I can't get anything done, right? And I think that's where the message is that that's no longer true. There is so much that you can do from home, and the past few months has given people insight into this. You can actually do a number of tasks, whether it's personal, whether you're shopping for groceries or for personal products, whether you're interacting with people around the world, having virtual meetings, you're still meeting your deadlines, you're still accomplishing a lot of things that you previously felt you had to do in an enclosed area called the office from home. So the technology exists, it is there. We are able to leverage on that, to access care, to have meetings. That is what is going to allow us to continue to practice safe distancing, and to keep us from being exposed to to this infection or to other future issues, while at the same time allowing us to continue to almost work as normal.
Perfect. I couldn't agree more to what you've already said. And I'm sure technology is here to broaden our horizons, to discover a new side of it. And as people say, this is the new normal. And I'm sure when we talk a lot has been talking about challenges, but I think it's time to talk about the positive side of it, how it's revolved and bring out a new era in terms of understanding what could be the future workplace be like, what could be the future patient experience be like, and what could be the future caregiver experience be like. And
Mm,
before I actually end the session, and I'd like to ask two more questions, if you allow me to do so, is that
sure.
when we talk about patient experience, we're really talking only about patient experience, and we never delve on talking about the most important piece in the puzzle, that is caregiver experience. And how do we make sure that that element is not being ignored, and it's given similar amount of emphasis as to what patient experience is given.
You're right. I think the caregiver very often is ignored in these conversations. They are often an afterthought, because everyone's focused on the clinical care of the patient. And I think that we know that patients don't get better in isolation. They require people around them, and it's not even the providers who see them maybe once a week for an hour. It is the care provider, the caregiver rather, the individual who's there with them day and night, the one who does all sorts of small or large things in the background that allow an individual who is ill to recover. um, this conversation, I guess, just needs to continue. Awareness of the needs of caregivers, and how to alleviate their stresses, how to help them reduce their burdens so that they can continue to perform their tasks efficiently, effectively, and also they get the financial support to allow them to, for example, take time off work so they can look after a loved one. All of these things do need to be raised to the forefront. And again, we can use technology. One of the things that caregivers often have is difficulty in deciding, what do I do in this situation? I'm trying to feed someone via a tube and the tube is blocked. What do I do next? So the patient may not be aware. This
Hmm.
is a caregiver problem. And so the caregiver then may have to call different people, but because they're not the patient, they may not be able to speak to the care provider. They'll say, no, I need to speak to the patient because of confidentiality issues. This is where we can support them. We can give them access to a variety of different, uh, very, very accurately curated databases online, for example, where they can get the teaching that they need, they can get the answers that they need, and they're able to communicate with individuals who can support them and help them to make the right decision in these situations.
Totally agree to that. And I'm sure technology is there to support the caregivers rather than add more to their existing workload that they have, that would rather
Absolutely.
create burnout among them. And I'm sure there are the frontliners are the superheroes in the current time for fighting the battle that they are. And before I end, I'd like to ask one last question. As a speaker at our upcoming conference, which is Patient Experience and Engagement Summit this October, what is that you're most looking forward to? If you'd like to share your thoughts on that.
I guess I'm looking forward to interacting with the attendees and the presenters to understand how the current crisis has impacted their lives. So we know that throughout history, humankind has been resilient and found ways to adapt to adversity. And I think that we have a lot to learn from each other. It'd be very interesting to see how others have overcome the issues that have arisen from COVID, and how they've evolved despite the restrictions that were implemented and continue to be implemented across the world. I think this would be a really, really good time for us to share ideas on, how to improve things both from a healthcare perspective, a wellness perspective, sorry, and even a non-healthcare perspective, meaning how do we perform certain tasks that previously we were only led to believe could be done, let's say, in a face-to-face situation.
True.
And of course, how different people have leveraged on technology in order to be able to get things done where, again, previously it was not thought possible. I would love to see how others have done it.
Great. And that's what our intention is, to deliver a valuable platform for people to benefit from, to understand and get inspired from the experiences of the others and understand how they can overcome their challenges using the experiences of their peers in the industry. So thank you very much for your very valuable inputs, Dr. Ravi. It was a great pleasure to have you join us. We sincerely appreciate and look forward to hearing back from you more in detail at the event later in October. Thank you very much for joining us today.
My pleasure. Thank you.